Welcome back to Science for Fun Academy channel. Today we're diving into the world of another gram-positive coccus known to cause human illness, Streptococcus pneumoniae, also known as pneumococcus. Streptococcus pneumoniae is a gram-positive coccus that typically appears in pairs with distinctive lanceolate appearance when viewed under a microscope after gram staining. This characteristic pairing is a helpful clue in its identification. When grown on blood agar, Streptococcus pneumoniae usually exhibits alpha hemolysis and typical draftsman colonies. This means it only partially breaks down red blood cells, creating a greenish or brownish discoloration around the colonies, rather than the clear zone seen in beta hemolysis. Streptococcus pneumoniae commonly inhabits the human respiratory tract, particularly the nasopharynx. It can cause infections in the lungs, sinuses, ears, and even the meninges, the membranes surrounding the brain and spinal cord. Streptococcus pneumoniae is primarily spread through respiratory droplets when an infected person coughs or sneezes. Close contact with an infected individual increases the risk of transmission. Streptococcus pneumoniae is a major cause of pneumonia, especially in children, older adults, and individuals with weakened immune systems. It can also cause sinusitis, ear infections, otitis media, and a serious infection called meningitis, which is an inflammation of the meninges. Invasive pneumococcal disease, where the bacteria enter the bloodstream, can be life-threatening. Diagnosis of Streptococcus pneumonia infections depends on the site of infection. For respiratory pneumonia, a sputum sample might be collected. Blood cultures are used to diagnose bacteremia, bloodstream infection. For suspected meningitis, a sample of cerebrospinal fluid is obtained through a lumbar puncture or spinal tap. Distinguishing Streptococcus pneumoniae from other streptococci often involves several methods. Biochemical tests such as the optokin sensitivity test, showing a zone of inhibition, and the bile solubility test, clearing of turbidity, are helpful. However, definitive identification is often achieved using a technique called MALDI-TOF-MS, matrix-assisted laser desorption ionization time-of-flight mass spectrometry. MALDI-TOF-MS analyzes the unique protein profile of the bacteria, providing a rapid and accurate identification. Treatment of Streptococcus pneumoniae infections depends on the severity and location of the infection, as well as antibiotic susceptibility. While penicillin was once a highly effective treatment, increasing antibiotic resistance has become a significant concern. Other antibiotics such as cephalosporins, macrolides, fluoroquinolones, or vancomycin may be used depending on the strain's susceptibility. It is absolutely crucial to consult with a medical professional for diagnosis and treatment. Do not attempt to self-diagnose or self-treat. The information provided in this video is for educational purposes only and does not constitute medical advice. Thanks for joining us on Science for Fun Academy. Subscribe for more fascinating explorations into the world of microbiology.